Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan, program host for Let's Talk Together. And today we're talking prostate cancer. And my guest today is Abby Koons, nurse practitioner with Reid Oncology. And let's welcome Abby.
Thank you, Sherry.
And before we get started, Abby, how long have you been at Reid? How did you come to Reid? Tell us a little bit about yourself.
I've actually been in oncology for 31 years now. I originally started as a floor nurse at Reid. I eventually went back and got my NP, and I've been a nurse practitioner in oncology for 22 years. I left for a few years and went to Ball Hospital, and I came back to Reid approximately 7 years ago in the oncology department.
Oh, great. And we're happy to have you at Reid.
I'm happy to be here.
So, prostate cancer, and I'm going by some information you sent to me.
Yes.
It says the American Cancer Society estimates approximately 313 and 780,000 men will be diagnosed with prostate cancer in 2025.
Yes, and that's across the United States. So, just to put that into comparison, I wrote down the numbers also for other cancers.
Mm-hmm.
For women, breast cancer is approximately 316,000, so pretty comparable. For lung cancer, it's 226,000, and then for colon cancer is 107,000, and those typically are the most common cancers, and you can see that prostate kind of tops those numbers, so it is a fairly common cancer.
And with that, what are some of the risk factors?
So there's risk factors that I kind of divided into two.
Okay.
One would be risk factors that you can change. So that would be things like diet, obesity, smoking, things like that. There are factors that you can't change as well, which would be older age. Typically, prostate cancer is more common in men over the age of 65. It definitely starts to increase after the age of 50, your risk for prostate cancer, just in general. As far as race and ethnicity, African American men are more likely, as well as men of Caribbean descent. Unfortunately, you can't change those kind of things. You also can't change your genetic makeup.
Right.
And so there's two parts to that. One is just the family history in general. If your father or brother have prostate cancer, you have a significantly increased risk of prostate cancer. If they had it at a younger age, that risk more than doubles. So it's a huge risk. Something you need to be aware of is your family history. On top of that, there's also genetics and genetic mutations that play a part in prostate cancer. So men with family history, a lot of times men just in general that have prostate cancer will be tested for genetic mutations. The most common being the BRCA mutation, and the BRCA2 is most common for prostate cancer. Mm-hmm. That significantly increases your risk for prostate cancer as well. So there are a lot of things as far as risk factors that can go into prostate cancer. And again, some you can work on, some you just have to be aware of and make sure that all of your providers are aware of those family histories and any genetic mutation you might be aware of.
So truthfulness is really important.
Yes, it's huge.
We have, I know we were just discussing a gentleman, and he mentioned that all of his brothers, the entire family has prostate cancer.
We see that a lot. We see that from, again, I don't know, how far back families tend to pay attention to those things. And sometimes I think like grandparents and great-grandparents, you don't always know whether they truly had it or not because there wasn't the screenings available, there wasn't the information available. So I think sometimes prostate cancer is one of those typically slower growing cancers. So families weren't aware that their grandparents or great grandparents passed away from prostate cancer because they were just never diagnosed.
On that note, last year I had attended, I was asked, because I'm out in the community, and some different family reunions asked to make sure we took information about different screenings, mainly like breast cancer and prostate cancer. And then they just had a section of information
Oh,
that
that's
people
great.
could look at.
That's
Because
great.
on the other hand, we seem to only get together for funerals.
Yeah.
So while we have people here for a joyous occasion
That's right.
to
Let's do something
educate. So
preventative.
yeah, so that's a
Exactly.
real. I really thought about that.
Yes, that's
If people
huge.
reach out to us, it's like just make sure we have the information to give to people.
Mhm.
And when you were saying, explain a little bit more about the genetic mutations.
So there are changes in the DNA that occur. They're called pathogenic mutations. It can be anything from just a malformed DNA to a broken leg in the DNA. When these specific variants occur, now you can have a variant that doesn't relate to a pathogenic mutation. When those specific variants occur, then it increases the risk of cancer cells and then in turn the risk of cancer. I use the BRCA mutation because it's the most commonly known. With BRCA mutation, I always like to make patients aware that there are more risks than just prostate cancer as well. So that's why if you are somebody that qualifies or if you know that your family has it, please get tested for this. So BRCA mutation, there's a risk for female breast cancer, male breast cancer, ovarian cancer, pancreatic cancer, prostate cancer, and melanoma. Now, that doesn't mean if you have this mutation that you're going to have absolutely all of those cancers, but it does mean that your risk is significantly increased over the general population. And in turn, when we know that, we can provide some extra surveillance, medical management type things to hopefully either provide early detection or prevention of those cancers.
And as we look at another part of the risk factors, diet.
Yes. So diet, they don't necessarily feel that diet specific has a huge risk in the overall risk of prostate cancer, but they do see that men who have a higher intake of calcium, whether that's in your diet, like if you're a milk drinker, if you're a cheese eater, something like that, or if you take supplements, that you have more risk or more incidence occur of prostate cancer. What the exact link is, they don't know, but they do find men that are calcium, have a high intake of calcium, have that increased risk. On the other hand, too, it's always important to have a good diet, a healthy diet, making sure you have the colorful fruits and vegetables, the whole grains, the healthier proteins, as opposed to like your red meats and things like that. That reduces your risk really of most cancers, but also helps with prostate cancer as well.
Got it. And obesity.
So obesity too is just like the diet. It doesn't increase the overall risk of incidence of prostate cancer, but we do find that obese men that get diagnosed with prostate cancer unfortunately have a worse outcome. They typically have a more aggressive cancer, and sometimes that may be because symptoms aren't noticed until the disease has progressed. And so by keeping your weight healthy, that tends to reduce the risk of the aggressiveness of the prostate cancer, or we find it earlier.
And another issue is smoking.
Yes. Yes, smoking, I mean, we know smoking relates to a lot of cancer risk. Now, it doesn't say that it increases the complete incidence of prostate cancer, but we know it's linked. We know that those patients have poor prognosis. They have worse tolerance of the treatments. In general, that's not every patient, but the majority of patients who smoke. And so we do recommend smoking cessation, partly because it decreases cancer risk, also decreases the other health issues that you have, and in turn helps you to do better with any treatment that you may have related to prostate cancer.
And well, how's vaping?
Same thing.
It's on that
Same
same
risk. Yes, they find that it is the same risk as tobacco use. So, and again, I do feel like nicotine is still in some of those vapes too, and I think that's our problem.
I just read an article explaining towards the end of the vape, there's more metals going in your system. So,
Yes. Yeah, and I think that it definitely causes more lung damage, but I still feel like in the studies that I've looked at, although they're not complete studies yet, they're in progress, they're finding that the vaping patients are doing just as bad as the smokers that smoke tobacco.
and when you talk to them, they swear it's different.
They do. They do.
So, as a nurse practitioner, how do you deal with that?
That, it's just something where you just have to be honest with your patients. Let them know they still are going to make their own decisions, and you're aware of that, and you try to accommodate their care knowing that that's going to happen. But you can tell them, here's case scenario, this is my guy that vaped and was assured that he was going to do fine with this prostate cancer, but continued to vape, and he had a poor outcome. The lung involvement is huge because a lot of these treatments that they get for prostate cancer will cause some shortness of breath and issues there. And so I think that just need to hear it. And if I don't tell you, I don't know that you ever hear it. So that's my job, to let you know that I am concerned this is going to be a problem on your prostate cancer journey.
Is that I would think that would be a challenge if you don't tell them, if they haven't heard from a medical professional.
Mhm. Yeah, I think it is. And I think it is something that a lot of people kind of avoid because you don't have all of the concrete statistics about vaping right
Mhm.
now. It's all still in process. So it is a challenge because they're going to look at you sometimes and say, "How do you know that?"
Right.
Well, from experience, I can tell you how my patients did. And I can tell you from early signs of studies that we follow that there is a problem with vaping just as much as there is tobacco use.
And inflammation of the prostate.
So inflammation of the prostate, that again is something that is preventable in, one thing, making sure you're drinking plenty of fluids. The other thing that increases your inflammation risk is sexually transmitted diseases. So, most people use birth control to avoid pregnancy, but it also is for protection. And those sexually transmitted diseases can increase your risk for prostate cancer because of the inflammation it causes. So protection that way. And then also, again, good fluid intake, make sure you're flushing the system so the inflammation's not there. And watch for signs. I mean, if you're having discomfort with urination, pain with urination, a lot of times we assume that's a urinary tract infection, but if that doesn't show up, don't let it go and assume that it's okay, because that may be inflammation in the prostate that needs to be treated with an antibiotic or a steroid.
And so, what are these factors that we can change?
So
Or
again, with the diet, again, the healthy fruits and vegetables, antioxidant foods, your colored vegetables, whole grains, things like that, that will help the diet. And then again, I'm not saying to eliminate calcium, but maybe just make sure you're not taking in too much calcium. If you're drinking 6-8 glasses of milk a day, that might be a little bit much. Maybe cut it back to 2. And then again, make sure you're incorporating water with that too to help flush the calcium through. Always check with your primary care provider before you take a supplement like calcium as well, to make sure, if your calcium levels are on the high end of normal, you may not need it. There are some times, if your bones are thin, you have osteopenia, osteoporosis, they're going to recommend some intake of calcium. That doesn't necessarily mean you're going to have prostate cancer, but it is something that you need to make your primary care aware of so that they can watch for that if they're increasing that dose.
have you seen an increase, or is there any studies with athletes? Because if often, especially if they're younger, they're really trying to get them to drink milk, and it's going to break
Yeah.
bones. So,
Yeah. And I guess I should have clarified, the calcium intake is more 50 or above.
Okay.
Age 50 or above. The younger athletes, their body can accommodate that. They're going to flush it through. It's going to strengthen their bones. It's the older patients that tend to have the issues with the higher calcium intake. And so I think athletes actually are safe as far as that, just because they're moving around. That calcium is being used and worn off. So,
And one of the things that smoking cessation, does that
That
How would
makes
that
a
help?
huge difference. So, again, it's going to decrease the risk of any cancer. Being as though we don't know that it by itself specifically increases prostate cancer, it will definitely improve the outcome of your prostate cancer if you stop smoking. You're going to tolerate treatments well. Typically, you have a better response because factors from the smoking, such as nicotine and that, aren't going to be present to block what the chemo or whatever treatment you're getting is trying to do.
And so back on back on the risk factors and talking about things that we can't change.
Mm-hmm.
So knowing your family history.
Yes, that's huge. Again, some families are not families that share that openly, but it is important. I have a couple case studies that we'll go over later. One of them wasn't aware of any cancer in his family, and that would have made a huge difference in how he was monitored, how screenings were recommended. But also just knowing that you can make sure you're getting your screening, whether it's, breast cancer and you're getting your mammogram, whether it's ovarian cancer and you're getting a pelvic exam, colon cancer and getting colonoscopy, the same with prostate cancer. You can get those PSAs, you can get those digital rectal exams and hopefully provide information. And it affects how early you start those. So it does make a difference on screening recommendations based on your family history too.
And for so long, families didn't talk about that.
No.
They
No.
just said they're sick.
Yeah.
And it's like, why are they sick or whatever? And it's none of your business.
Right. Right. They've got it taken care of. They don't
Right.
to tell you. So
It's not understanding that you're actually helping others.
right. And
And
doing so.
if then when you find out that 4 of the 5 brothers or whatever have cancer, then you're more apt to look at it.
Yeah.
Or like,
Hopefully-
maybe what happened with you? And
Right. And
like,
hopefully
share.
take better care of yourself. And
Right.
also, again, make your doctor aware or nurse practitioner so that they can help you along that way too.
The when you're saying and make sure that your primary care doctor is aware.
Yeah, that's huge because they're, in oncology, we typically see you after the fact. So those primary care providers are out there providing all of that screening that you need. They're making those recommendations, but again, those recommendations change if you don't know your family history because the ages are significantly different depending on what your family history is. So it's important to tell them.
Yeah. Let's talk on the screening recommendations.
Okay. So the screening for prostate cancer is a digital rectal exam. And I will say that you will get some people that don't necessarily agree with the digital rectal exam as a screening, but it's still the preferred means and a PSA. So both together really give you the best information. There are some providers that are going just to the PSA, and that's fine if that's what they want to do. And then in turn, if something's abnormal, let urology do the digital rectal exam. So I did want to put that out there because some people are like, I'll do a PSA.
Okay.
So anyway, so it's for usual risk patients, which would be not necessarily a family history of prostate cancer, or again, I throw in cancers that relate to mutations like, your mother had breast cancer or ovarian cancer, things like that. 50 years old is what they recommend to begin screening. If you have a brother or a father who had prostate cancer, 45 is the age they recommend to begin those screenings. If that brother or father had prostate cancer at an earlier age, though, it's 40 years old that they recommend. So there is, again, that's all the more reason why you need to make sure you're aware of your family history and your primary care is aware of that too.
And I want to make sure that one thing I don't forget, because we want to make sure people are aware of that there are screening opportunities.
Yes, Reid is having a free screening for prostate cancer. It's on September 16th. It's from 3:30 to 6 p.m. You can get a hold of Maria. She will get you scheduled. That number is 765-935-8847. And that's for any individual. Just call, please, and make an appointment, and they'll get you in for the screening. It is free. And it doesn't necessarily have to be someone that's having symptoms or anything like that. Just get out and get screened for your safety.
Great. We'll put that information out before
Okay.
we end as well.
Okay.
Give me an example of one of your case studies.
Okay. So I have a couple case
Okay.
studies that I brought. The first one is a 63-year-old male. Very nice gentleman. And both of these patients, I can't even find my paper on him. Look at me go. Are patients that I have actually come in contact with for various means. I do genetic testing. So one of them was from the genetic testing. I have it. Thank you. He has a history of hypertension. Otherwise, he's healthy. He's a very active male. He loves playing pickleball, things like that. He's married. He noticed that for about 3 months, he had a change in urine output. He felt like the stream was a little bit slower than normal. He really didn't think about it. He said, I was 63 years old. I assumed it was just an age thing. Maybe my prostate was a little bit bigger, and kind of left it alone. But after 3 months, he mentioned it casually to his wife and said, something doesn't seem quite right. And so she stepped in. In his words, he said she strongly encouraged me to go to a prostate screening that just happened to be the next week. So he went to this prostate screening. They did do a digital rectal exam. They found a nodule. And so from that, he was referred to urology. And I will say that urology typically takes care of the first part of prostate cancer or abnormalities. They're very good at that. And they also repeat the digital rectal exam to make sure their findings are the same before they proceed with any other testing. So he did that. The PSA was significantly elevated, and he had not actually had a screening PSA, which was kind of his choice from what he said, because his doctor recommended it, and he kind of bowed out of that. So long story short, he had a prostate biopsy. It was adenocarcinoma of the prostate. It was early. The Gleason score was low, which means it was early stage. And so he just underwent radiation therapy, and he has been cancer-free for 5 years now, which is fantastic. And I believe it's 100% because of the strong encouragement from his wife, who said, go get screened, please. So I will point out with this particular gentleman, though, this is the one that I was talking about, that down the road when we were talking at a few appointments, he said, I never realized, but I should tell you, my mother had breast cancer, my grandmother had ovarian cancer, and they think my grandfather on that side had prostate cancer, but they didn't know for sure. And I said, yes, that would have been important.
Ding, ding, ding.
Yes, and then you probably would have already been screened for this at an earlier age if your primary care provider would have known that.
Right.
So again, I'm thankful that there was a screening for him to go to, but I do believe that his wife probably would have eventually made him go to his provider as well. But it just worked out that screening was the perfect timing. So that was a great situation.
Another case?
I have one other one. Also, very nice gentleman. He was a little bit younger. He was 58 years old, African-American male. He really not much medical history, just hypertension, hyperlipidemia, diabetes. They were all well controlled. He was very aware of his health. The best thing is he was also aware of his family history. His father had prostate cancer at age 70, and his paternal grandfather had prostate cancer at age 75. So he was aware that his risk was increased. Even though it was a grandfather, not a brother, the risk is still increased. So he was very well aware of his health. He watched for symptoms constantly, and he had no symptoms whatsoever. But he was out and noticed that there was a free screening at the local hospital, and he went to that screening. And at that screening, they really just found that his prostate was enlarged. And really at 58, it shouldn't have been as enlarged as it was, so they were concerned. They referred him to urology from that screening. His PSA was elevated. He went and had a biopsy based off of the PSA, because they actually checked it twice before they did the biopsy to assure that was correct, because sometimes things like inflammation, prostatitis will increase that PSA. So they double-checked it to make sure that was correct. He also had adenocarcinoma of the prostate. It was also an earlier stage. But again, taking into consideration the family history and that, he was monitored by urology. I think they were seeing him like every 3 months for the first year. At the end of that first year, his prostate or his PSA went back up. So they did a bone scan at that point. He did have one nodule on his pelvic bone. He had radiation therapy and has been cancer-free for 8 years now.
That's amazing.
So I again say that screening probably saved his life, because if you think about it, when that bone met came in a year's time, that probably was going to be a little more aggressive cancer, but because they found it so early, that probably saved his life and made a difference in the prostate cancer that he had.
Wow.
So it's huge.
And so, long story short on prostate cancer.
Long story short, so again, know your history, know your family history, get to and stay at a healthy weight. Make sure you're eating healthy with again, as I mentioned, colorful fruits and vegetables, the whole grains, things like that, your healthier meats, chicken, fish. Try to avoid large amounts of calcium and large amounts of red meats. And then be aware of symptoms. And symptoms for prostate cancer can vary, but we do tell men, if you notice a change in your urine stream, if it's weak or slower stream for a long period of time, that's something to report. If there's blood in your urine, if there's pain with urination or erectile dysfunction, those are all symptoms that can associate with prostate cancer. So it is huge to know those symptoms as well. And then again, make sure that you are telling your primary care what's going on with you. If things are changing, don't let them linger. If it's a one-day event, then that's different. But when something like the patient I talked about, it lasted for 3 months, it needs to be checked out. And I'm sure your primary care will gladly take care of that. And then the most important thing is get screened, please, for any cancer screening, but definitely prostate cancer. Stay on top of that. You see the numbers that we have across the United States for prostate cancer. Get screened so we can find it early and get it taken care of and hopefully save your life.
So, as we wrap up, Abby, tell us that information about the prostate screening in September.
It is September 16th. It's from 3:30 to 6 p.m. At Reid. And you can get a hold of Maria. She's the scheduler for that. The number is 765-935-8847.
Okay. And we want to thank you, Abby, for joining us today on Let's Talk Together.
My pleasure. Thank you.
Thank you.